Okay, so today I'm going to be talking about some of the emotional changes that we see in dementia. And I guess I wanted to start with something very basic, but something that seems to be a common misperception, at least in terms of people from the general public that I speak with. And that's this idea that changes in dementia are really changes in memory. And I'm sure a lot of you have had this frustration speaking to your friends and other members of the family that when they hear that someone has dementia, they automatically think about the difficulties with memory. But what's really key in frontotemporal dementia is that it's really other symptoms that are important. And so you heard from John earlier that changes in language can often be the common features, particularly in semantic dementia and progressive non-fluent aphasia. And as we've heard from Emma and Rebecca and John, there's also these quite significant changes in terms of emotion. And so that's the research or the area that I'm really focusing on, trying to understand what these changes in emotion are. So just to start off with, I wanted to just touch on what is an emotion. So emotions refer to what an individual experiences in response to the environment. And I'm sure you're all aware there can be lots of different types of emotions. So you can feel angry or sad or happy or joyful or fearful. So there's lots of different types. But when we think about it in terms of a research area, we really focus on these ones in red. And these are the 6 basic emotions. And so these are the types of emotions that we know tend to be present from very early on. So even infants show these emotions. And they tend to happen quite automatically and rapidly. And our ability to understand and express these different emotions is usually quite subconscious. So it's something that we do without really thinking about. So is emotion affected in dementia? So I guess the first thing to point out is that dementia is really an umbrella term. And so frontotemporal dementia is one of the different types. But there's lots of other types. So there's things like Alzheimer's disease, vascular dementia. And so whether your ability to understand and express these different emotions is affected really depends on the type of dementia that you have. So in something like Alzheimer's disease, actually these difficulties with emotion are quite mild. And so even if you see someone several years into their disease, they actually can often still have quite good manners and, they'll be quite caring and, they won't really have these marked changes. But what we know in frontotemporal dementia is changes in emotion and behaviour are actually very common. So these can include things like apathy, so a loss of motivation or a loss of interest in participating in hobbies or things that people were previously interested in. It can also include things like a loss of empathy, so difficulty in understanding how other people might be feeling. People with frontotemporal dementia might show inappropriate behaviours in social settings, so they might swear or they might do things that are quite embarrassing that they wouldn't have done previously. Or they might just be less interested in taking part in social things. So they might not want to go to that family event as much anymore, or they're not interested in playing with their grandchildren. And they can often show alterations in their personality. So really what we know from all of these things is they sort of point us in the direction of thinking that these are all underpinned by a change in emotion processing. So why is emotion affected? And John touched on this earlier. So we know that different parts of the brain have different jobs. And so, for example, this part of the brain down here is very important for coordination and things like walking. And so if you have a stroke or something that affects this part of the brain, you'll have problems with coordination. However, if this part of the brain is affected for some reason, you'll have problems with navigation and you might get lost. And you can see there's parts of the brain for memory, parts of the brain for language, and there's also parts of the brain that we know are important for emotion. And importantly, these regions of the brain, so the frontal lobes and the temporal lobes, are the parts of the brain that tend to atrophy or shrink in frontotemporal dementia. And it's really the shrinkage in these frontal and temporal brain regions that cause difficulties in emotion processing and emotion recognition. So just to give you a little bit of an idea of what I mean, if we look at a brain here, So this is from the side, and this is the front part of the brain. So now if we look at one of the MRI scans that someone's had, so this is through this part of the brain at the front, looking front on. And so what you can see here is the brain. Now if we look at someone with frontotemporal dementia, you can see all of this shrinkage in these frontal parts of the brain. So it's really the shrinkage in these parts of the brain that's causing these problems with emotion. So emotion can be affected in lots of different ways, and I'm going to go through some of the different ways it's affected and what we've already found in terms of some of the research that we've been doing. So the first part that can be affected, and this is really the area where most of the research has been focused on, is the ability to understand different emotions, so understand how other people are feeling. But it can also affect how people express different emotions, so how they show if they're angry or sad or happy. And it could also influence the way people feel different emotions. So do people with frontotemporal dementia feel emotions in the same way that other healthy people do? So I'm going to talk about understanding of emotions first. So emotions can be portrayed in lots of different ways. So we use our facial expressions as probably the most obvious thing, so whether someone's smiling or frowning or grimacing. But we also use things like our tone of voice, body language, and also in things like music are used to express emotions. And so in order to understand emotions, you rely on all of these different cues to try and identify how other people are feeling. In the clinic, really what we focus on is recognition of facial emotions, and this is one of the tests that we give people that we see here. So if you look at this face and have a guess, so is this person angry, disgusted, fearful, sad, surprised? And so I hope that most of you would be able to say this person's feeling angry. And again, this is something that most people find relatively easy. And indeed, when we look at healthy adults, so controls here, they get almost 90% correct on tests like this. But when we look at people with frontotemporal dementia, you can see there's a real decline in their ability to understand these emotions. And it seems to be true across the different subtypes, so in behavioural variant and semantic dementia and progressive non-fluent aphasia. And I think this is really interesting given the question we just heard earlier about progressive non-fluent aphasia. So in fact, if I was giving this talk 5 years ago, I probably would have said there's no problems with people with progressive non-fluent aphasia, and in fact no one had really looked at it. But the research that we've shown has really demonstrated that they do have problems with this as well, and it's really been underestimated in the past. The other thing that we've discovered is that problems seem to be more in terms of understanding negative emotions. So patients with frontotemporal dementia seem to have more problems discriminating between whether someone's angry or whether they're sad, whereas they still seem to do quite well at understanding whether people are feeling happy. So there seems to be some differences there. So in everyday life, obviously this can have quite significant implications. So it obviously affects your ability to understand how other people are feeling, but it can also make things like social situations quite confusing, and this might explain why patients with frontotemporal dementia act strangely in social settings, because they don't understand these subtle social cues that you and I take for granted. It can explain why they react unpredictably in different situations. And we've also found that it also seems to impact on the types of events that they remember. So for you and I, our memory tends to be coloured by emotion. So often when you think back in the past, you'll tend to remember things like weddings that you attended, or if you saw a car accident, things like these emotional events, in a lot more detail than everyday non-emotional events, so things like doing the groceries or filling up the car with petrol. But what we've shown is that patients with frontotemporal dementia don't seem to have this same emotional boost to their memory. So they may not remember things like the wedding you attended or meeting their grandchild or these emotional events in the same detail as healthy individuals. So it seems that this impact on emotion is quite widespread. So what can we do about it? Is there any way that we can help patients? So in order to explain what we're trying to do in terms of improving people's ability to understand emotions, I need to give you a little bit of a understanding of what we actually do when we recognise emotions. So up here we've got different facial expressions or tone of voice or different things you might see in movies, for example. So first what you need to be able to do is you need to be able to look at someone's facial expression appropriately. You need to be able to look at the eyes and the mouth. You need to understand certain things about faces. You also need to be able to pay attention to these faces. You need to be motivated to, care about how someone else is feeling. And things like language might also be important. So do you know what anger means anymore? Do you know what disgust means anymore? And then finally, your ability in terms of understanding these emotions needs to be preserved. So all of these things need to be intact in order to recognise different emotions. So a breakdown at any of these levels can impact on someone's ability to understand. So going back to how do we improve emotion recognition? Well, one of the areas that we've been looking at is if you simply exaggerate the emotion that's being expressed, does that help? So this is, again, our man who looks angry, but using the computer, we've been able to exaggerate how angry he looks. So the brow becomes more furrowed, the teeth become more obvious. And so we then did the same emotion recognition test in the patients with frontotemporal dementia and see how they fared. So what you can see, unsurprisingly, controls or healthy adults do well regardless, so they're almost at 100%. But what's really encouraging is that as the exaggeration increases, individuals with semantic dementia, behavioural variant frontotemporal dementia and PNFA actually improve. So their ability to understand these emotions gets better. So that really says to us that something simple like exaggerating the emotion might help people with frontotemporal dementia understand how you're feeling. And in terms of what it tells us about how people understand emotions, it suggests that some of these basic perceptual skills might be making things more difficult. And so if we can do things to try and assist how people look at faces, what they're looking at, and how they're interpreting it, it might actually improve their ability to understand these emotions. So now moving on to expressing emotions. So this is really an area that hasn't been very well explored to date. And I think that's really because it's quite difficult to objectively measure how someone's expressing an emotion and if that's abnormal. But what we do know is that in people with dementia, there's a couple of different things that we see clinically. So there's some people that might have a reduced tendency to express emotions. So their faces might not change, they might not show these emotions in the same way. But there's also a proportion of patients who show a very exaggerated expression of these emotions. So they might be very giggly, or they might be very teary, or show this sort of over-expression of emotions. And again, this can change over time as different areas of the brain become affected. So like Rebecca said, in the beginning, patients might be very disinhibited, so they might have this sort of overexpression of emotions. But as the disease changes and different parts of the brain become affected, they might begin to show less emotions. So as I said, it hasn't really been studied, but we do know that differences are definitely there. And this is an area that we want to look more carefully at. And so now the last area, so feeling emotions. So do people with dementia feel emotions differently? So in order to answer this question, I want you to think about when you're watching a scary movie, the sorts of feelings that you have. So you might have sweaty palms, you might feel your heart rate quickening, your breathing might become faster. And all of these things tell us that you're having an emotional response to this film. And this is the same in everyday situations. As your emotions change, these physiological responses that Rebecca was speaking about also change. So what we're doing now, and some of your loved ones may have actually been involved in these experiments, is we're showing people with frontotemporal dementia different emotional films, and we're actually recording perspiration, we're recording their heart rate, that we're recording their facial expressions to try and get an idea of whether the way that they feel emotions is also affected. So the last area that I wanted to talk to you about today, and it is in some ways related to emotion processing, and it's this idea of insight. So insight refers to the ability to recognise your own problems or your own deficits. And so this can be true in many different neurological conditions where people have problems recognising that there's actually something wrong with them or something that they find difficult. So, for example, if someone's had a stroke and they have difficulty moving their arm, they may not fully understand the problems that they have. And so we say that they've got a lack of insight. And in frontotemporal dementia, what we see is individuals often have problems recognising changes in their behaviour or their personality. And so when they come into the clinic, often one of the first questions that John will ask them is, why are you here today? And many of the patients that we see won't be able to give a good reason. They don't understand why they're going to the doctor, they don't think anything's wrong with them, and they don't identify any of these changes in behaviour and personality that their families and friends have seen. What's important to point out is that this is quite different to denial. So it's not a psychological thing, it's not something where they know the problems but they're in denial about them. It really reflects a problem in the brain that's important for things like self-awareness. And so to finish off with, I'm going to show you some findings that we've just had looking at insight in patients with frontotemporal dementia. And so this is a questionnaire that you may have completed in the last couple of years. So first we give the questionnaire to all of our participants. So you've got behavioural variant in green, semantic dementia in yellow, and Alzheimer's disease in red. And they're compared to healthy controls. And so we ask them to rate themselves on things like, how well do you recognise different emotions? How well do you empathise with other people? When you're in social situations, what do you do? Are your behaviours appropriate? And what you can see here is that there's really no difference. So all of the patients rate themselves very similarly to controls, and they think they do these things very well. But when we ask family members to complete the same scale about their loved ones, you see a very different picture. So what you can see here is that carers are rating their loved ones very, very differently in terms of their ability to recognise emotions, their ability to empathise, and also their ability to conform in social settings. So this really highlights this problem of a lack of insight into these difficulties, and it can also make things like managing these behaviours challenging when the patient doesn't realise that they actually have any problems. Yeah, so you can see that there. So just to finish off with, I wanted to give you some take-home messages because there's a lot of information coming from this morning. But first off, I want you to know that difficulties in understanding emotions are very common in dementia, and particularly in frontotemporal dementia. And these difficulties impact on things like behaviour in social situations, and it can also make relationships quite difficult and can be quite upsetting for other family members. The emotional deficits, importantly, are due to changes in the brain. So it's not a reflection of how they feel about you necessarily. It's not a reflection of that they're not interested anymore. We know that it's due to changes in the frontal lobes of the brain. Encouragingly, positive emotions are less affected, so their ability to understand things like happiness is still quite relatively well preserved. And some of the research that we're doing suggests that very simple things like exaggerating your emotions may help patients understand how you're feeling. We also think that the ability to express emotions and feel emotions is probably affected, and that's an area that we're looking at more closely now. And finally, often people with frontotemporal dementia have this lack of insight into the problems, and again, that's because of brain changes that make this quite difficult. So that's all from me. Thank you.